So my name is Colleen Hugel. I live in Belleville, Ontario, and my husband and I own a small animal hospital. So he's the veterinarian, and I am one of his assistants, receptionist, manager, kind of jack of all trades. Yeah.
That's amazing to hear. So let's talk about your, so you were diagnosed with breast cancer. So do you want to just talk a little bit about when, how did you first find out, how old you were, things like that?
Sure. So I was 51 when I first found the lump. So just to start, I guess at the very beginning, when you turn 50, the government sends you a nice little letter that says, hey, you're 50 now, it's time for your first mammogram. So went and did that when I was 50, it was normal. And then the following year, about 14 months later, is when I felt the lump in my breast. So
when were you in the shower? Were you doing like a check, or were you just like, putting
I wasn't. I literally was going to bed. I'd been talking to my daughter, and she lives in New Brunswick. So I've been talking to her on the phone. We were supposed to go see a concert in Toronto. We were supposed to go see Pink. And so she was flying in for this concert, and we were all excited. Well, we found out that Pink was canceling her concert. So we were having this big, long discussion, and is she still going to, was my daughter still going to fly in, blah, 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 blah. Stopped the video chat. It was probably about 11:30 that night, and I went to bed. And when I went to bed, I kind of put my hand under my side, and I felt something.
How did it feel?
Like a big hard lump.
Like a golf ball?
Like a golf ball, exactly.
Hard. Okay.
Really hard.
Not painful.
Not painful at all. And it was the first that I had noticed it. So I kind of sat up and I thought, what the heck is this? And I said to my husband, don't get excited, but I need you to feel my breast. So he felt it, and he immediately started to cry. Being a veterinarian, so being a doctor, he unfortunately kind of knows what he's feeling. And so he pretty much knew right away, or suspected right away, that it was going to be something bad. So yeah, so it was total fluke that I found it. Didn't say anything. Like, I was going to Toronto the next day to meet my daughter who was flying in. So I had to keep it to myself. I'm panicking, but I didn't want to panic her until I had more information. So I had to sit on it for a couple days until I could get to the doctor, and they took it very seriously. As soon as I called and said, I found a lump in my breast, they had me in that day. Unfortunately, it took, so that was in May. It was Mother's Day. That was another lovely time to find it. It happened to be Mother's Day. So that was May 12th, and it took almost an entire month until I could get an ultrasound and a biopsy. So I had to go for another mammogram, and because it took a month, or the reason it took a month is they only had a radiologist in once a week or something who could read your scan right then and there. Usually you go for a mammogram and nobody reads it, for a few days or whatever.
Right.
So it took a little longer. It took a month. So I went for a mammogram. They could see something in the mammogram, sent me immediately for an ultrasound. And I will never, ever forget the radiologist telling me, he says, this is cancer. And he says, I'd like to biopsy it to know for sure. And I didn't hear anything after that. I was in the room by myself. I didn't have anybody with me. And so they did the biopsy right then and there. And as soon as he said,
right there. Oh, wow.
Right, yes, right then and there, they froze me and did the biopsy right there. But I mean, as soon as he said, I'm sure this is cancer, I didn't need to hear the results from the biopsy. I'm like, they see this all the time. If he thinks that's what it is, I'm pretty sure that's what it is. So
how was it freezing? How was the biopsy? Was that comfortable? Was it painful?
It wasn't that painful.
Okay.
They did freezing, and again, I just fell apart. I just sobbed and sobbed and sobbed throughout the entire procedure. And it looked like somebody had slammed my boob in the car door after. Like, it was so bruised. It was astonishing to me because it didn't hurt. So to have all that bruising, it just kind of floored me. Everything kind of happened very quickly. Like, it took a long time. It took a month, which to me was a very long time from when I found it until they could confirm that it was cancer.
Do you think it's because you were in Belleville, or do you think that was just?
I think because I'm in Belleville, because they only had the radiologist there once a week. So there's unfortunately a lot of women waiting for the same thing. And I found out later, actually, that I was the third woman that day to be diagnosed. And the radiologist actually had to go home when he was finished with me because he was just so,
of course,
upset, right? Because my reaction was, I'm almost embarrassed by my reaction now, as silly as that sounds, because I just lost it. And I just kept saying, I don't want to die. I don't want to die. No. Because that was my first thought. Right. So yeah, I think it took a while because they're only there once a week. There's also, unfortunately, a lot of women in the same situation. So once I had the biopsy, I had the results about 2 days later, and then I had to fly to New Brunswick to tell my daughter that I had cancer, which was like one of the worst things I've ever had to do. Yeah, like it's been hard, really hard. So then once I had the diagnosis of cancer, like, things moved very, very quickly.
They just say you have cancer, period, or did they tell you?
They didn't know. No, they didn't know the stage. So I immediately, once I got the diagnosis, I had to then drive to Kingston the following week and meet with my oncologist. So that's about an hour's drive. And that was just like such shell shock, because you're on the oncology floor and you're looking like, some of those people were just, they didn't have their hair, they were green, like, and I just thought, this is surreal. Like, why? I can't believe I am here. And so I met with him and he kind of laid out my options for me. I think I'm missing a step. I did see my surgeon before I saw the oncologist. That's right. So I got the diagnosis and then they sent me to my surgeon. And he told me the size of the lump. So it was 4.5 centimeters. Okay. They went back and looked at my original mammogram from 14 months before that, and there was nothing there. Nothing. So it was a very aggressive form. So he told me I had 2 options. I said I could do a lumpectomy with radiation, or I could do a mastectomy and radiation if it had spread to my lymph nodes or anywhere else. And the interesting thing is, I had, we've talked about breast cancer, like, off and on for years, whatever you hear somebody that has it, what would you do in that situation? And I always said, oh, hands down, I'd have a mastectomy. Like, I don't need them anymore. If it's between them and my life, like, hands down. So it wasn't really a decision that I had to think about. Like, I knew right then and there, I just wanted to have it removed. Statistically, I guess they say one isn't any better than the other. Like, a lumpectomy and radiation has the same sort of outcome as a mastectomy. I didn't really believe that. And I know that they're the professionals, but I wasn't comfortable with that.
Right.
So yeah, so met with the oncologist. He kind of explained my options based on my age, being 51 at the time. I was relatively young. And they just wanted to hit it with everything that they had so that I would continue to live a nice long life. So we went with surgery first, then chemo, then radiation. The chemo they wanted to do for sure. The radiation was going to be dependent on whether it had spread anywhere. So I had to go for more testing. And they already knew, based on my ultrasound when they did the biopsy, that one of my lymph nodes looked a little funny. I was in denial about that one. I had been bitten by a cat, and like, I don't know, a month prior to me finding this lump. So I was like, nope, that's what it is. Like, it's just in my breast. It's not my lymph nodes. It hasn't spread anywhere else. It's just from the cat bite. I was convinced, but I was just trying to justify things, right? Just trying to squash the panic that was building. So anyway, because when they did my mastectomy, it had gone into one, they removed 2 lymph nodes. It was in, cancer was in one of them. So then we opted for the radiation.
On one of the breasts or both?
Just one. So I actually wanted a double mastectomy, even though I only had a lump in one. My surgeon was like, let's just focus on the cancer for now. If it really bothers you, when you're all said and done everything, then we'll address that later.
Okay.
Having said that, he won't remove the other one. I still would like to have the other one removed.
Okay.
For peace of mind and for symmetry, but
course.
he's like, nope, not going to do it. It's healthy tissue. I'm not going to do it. So
And for the sake of, just education, what is the difference between chemo and radiation?
So chemo was intravenous injection every 2 weeks. I was supposed to have 8 cycles of it. So every 2 weeks, and you start out with a cocktail of 2 different drugs for the first 4 infusions, and then they switch it to a separate set of infusions for the last 4.
Okay.
And then, so that is supposed to target anything that's milling about in your bloodstream.
Okay.
The radiation was targeted therapy right to my chest wall, and that was 16 sessions like Monday to Friday for 3 weeks and a day. And so I had to drive to Kingston for that. So that, again, that was a little over an hour drive every day and the radiation took maybe 5 minutes from the time you walk in, get undressed, get on the table, they do their little thing and you're done, like very, very quick. Where the chemo would be, the infusions were typically lasting 3 to 4 hours. And that I could have done in Belleville, which was nice. So it was local.
Was it the radiation or the chemo?
The chemo, the first set of 4, they're the ones that make you lose your hair. So the first session, I had it, and they watch you like a hawk, because one of the drugs, if it gets outside of your vein, will like basically eat your vein out, kind of thing. Like it's really horrible stuff if it gets outside of the vein. So they sit there and you don't move, and they watch that go in drip by drip. And I didn't really know anything about chemo. You see it on TV, movies and stuff like that. That's so not
Really,
so not what it's like. So
what's the difference between what you see in movies and what it's really like?
I expected a lot more vomiting, to be honest, like to be graphic.
Yeah.
They give you so much medication now that there was a lot of nausea, but not during the infusion. So during the infusion, I felt totally normal. And again, surreal. Like, why am I sitting here for this first one? Like, I can't believe this is happening. And they come, like the nurses come, and they're all dressed like in these special gowns and stuff, because they're handling this toxin, right, that they're injecting into my body. Again, kind of surreal. But the first one, like they said, you'll feel fine today. Mm-hmm. So they call that day 1. The day that you get your infusion is day 1. By day 3, I thought I was dying. I never felt so awful in all of my life. They do give you a lot of anti-nausea meds. If they don't work, there's other options. So, but I almost feel like I might have felt better if I was able to be sick, as dumb as that sounds.
Right.
And I couldn't get out of bed. And that would last probably 4 or 5 days. What nobody told me was, I thought I would feel like that forever. The whole time that I was on chemo, I expected, by day 3, when I started to feel horrid, that was the way it's going to be for the next 4 months. And I said, I can't do this.
Yeah.
But what they don't tell you is by the second week,
Yeah.
you start to feel more like yourself again. So
Okay.
once it kind of gets out of your system, I guess it gets flushed out, then you do. By day 7 or 8, I was feeling myself again, just in time to go back and start it all over again. So that was the first set of 4. I wasn't prepared for that. I just wasn't prepared for how that would feel. I thought mentally that I was prepared and could handle it. And I pray to God I never have to go through it again. But if I did, I would be better prepared now. I would know I am going to have good days. It's not going to be all bad days. Your hair starts to fall out before your second treatment. So
All of it?
all of it. So I buzzed it. And I mean, it falls out everywhere.
Oh,
Like-
really?
Like everywhere.
I didn't know
Oh.
that.
So I didn't have to shave my legs, which was kind of nice. And the radiation, actually, I don't have to shave under one arm anymore because no hair grows back on that side.
So hair falls out everywhere, even like down there.
Everywhere. And in fact, it fell out down there first.
It's like a free body wax, but you know,
Yes,
Yeah.
exactly.
Yeah.
And the last thing to go were my
Eyebrows?
eyebrows and eyelashes.
Okay. So that was within the first session.
Yes.
Okay.
Yeah. Yeah. So before day 14, like before the second session, it was falling out. And I mean, so I buzzed it short, but I could just rub it like this and all the little stubble would just be everywhere.
And is that because of the chemo or the radiation or
The
both?
chemo. Yeah. So the chemo did that. So I did 4 rounds of this stuff that made me feel so nauseous, and I wouldn't even be able to walk from my bed to outside the house. By day 3, day 4, there was just I couldn't do that. By day 5, day 6, then I could make it to the end of the driveway. Yeah, like I don't know what I was expecting, but it wasn't that.
And did they, like, when you said they didn't prepare, like, is it a lack of the pamphlet didn't give you that information, or everyone is different, or?
Everyone is different for sure. Some people don't feel that badly, again, with all the drugs that they have available now. And there's different combinations of chemo. So for my type, I had an estrogen-based breast cancer. So they used XYZ chemo drugs. But if you had an HER positive type of cancer, which I don't know what that is, but they would use, D, E, and F chemo drugs.
Gotcha.
They did bring us all in. They had a group before I started chemo at the hospital, and everybody who was about to go under chemo came to this information session. And it wasn't just breast cancer patients, it was anybody who was having it. And I guess, yeah, I mean, I can't even articulate to you how horrid I felt. So it would be very difficult, I think, for a nurse to be able to explain, this is how you're going to feel. The second set of drugs, the second set of 4 drugs, didn't give me that fuzzy. Your head felt really fuzzy before, like I couldn't think, I couldn't read or follow a story or anything like that. My head just felt so fuzzy. I didn't have that. I didn't have the nausea for the second set of drugs, but it came with its whole other own side effects. So a lot of bone pain. Again, like just crying because you're in so much pain. But that would last 2 days and then you'd be okay again.
Okay.
So, unfortunately, I had an allergic reaction to that chemo.
Mhm.
And so I was supposed to complete 4 rounds of it. I could only do 2. It also gave me neuropathy in my hands and my legs. So I was limping, not being able to walk properly. I didn't have feeling in my fingertips. And they said if I continued with that drug, that would be permanent.
Okay.
So I didn't want to stop, because to me, the doctor said I needed to do this many, I need to do that many.
Yeah.
But he said the treatment is going to be worse now for you. Like you've gotten the majority of the benefit
Oh, after 2.
after 2 of the second. So 6 in total.
Oh, 2. Okay. So you've had 4.
Yeah.
Okay.
Yeah.
Out of 6.
So yeah, so I was supposed to do 8 in total. I only managed to get through 6. I did get the feeling back in my fingertips, but I still have neuropathy in my legs and feet. So I can't feel probably almost halfway up my calf on both legs.
Still to this day.
Still to this day, 3 years later, and I still have issues, but
Okay.
I'm alive.
You're
So,
alive. Yeah. And you got your hair back.
and I got my hair back. And like I said, it came back gray, like completely gray and curly.
And your hair was not curly before.
No, no. So I really struggled with that. Like I was happy to have hair back, but
Yeah.
I would look in the mirror and I'm like, who is that? Like, I don't know
Yeah.
who that person is.
Yeah.
Because I always had dark hair and I always like would throw some purple in there just for fun. And
Yeah.
it was, so I had my son's girlfriend at the time dye my hair for me as soon as I was allowed to do it. She
Yeah.
dyed it dark for me just because I couldn't stand who I was looking at.
Yeah. Yeah.
Yeah.
And any body changes, like obviously, but weight gain, loss, appetite, other
So
breasts, this breast, like how did you feel in your body?
appetite, again, you see on TV, like cancer victims are all like,
Yeah.
oh,
Yeah.
skinny. God,
Yeah.
no, I got fatter.
Okay.
So I was on steroids.
Okay.
So that makes you gain weight. The tamoxifen that I take now for the next 5 years also makes me gain weight. And tamoxifen is it's an estrogen blocker. Because as I said, my cancer was caused from too much estrogen, or I don't know. I guess too much probably isn't the right way to phrase it. But so, but during chemo, I craved carbs. It's all I could eat were carbs. So again, gain weight.
Right.
And you're not exercising because you can't, because you feel awful.
Yeah.
During treatment, after the first session, once I finally realized that, okay, I'm not going to feel horrid every single day until I'm finished.
Yeah.
Then mentally I was better able to handle things. And I could just kind of put my head down and I did it. Like, this is what you have to do. So you're just going to suck it up and you're just going to do it.
Yeah.
And I didn't think too much about anything else. After I was finished everything, I would say so I finished January of 2020. So these last 2 years have been almost harder than going through all the cancer treatments.
Really?
Yeah, just mentally. Because I didn't have time to think, which sounds stupid because I had nothing but time. I couldn't work or whatever. So you think you have nothing but time to think about things. But I didn't. I just thought about fighting it and beating it. So then, and you're seeing the doctors all the time, right? You're at the hospital.
You're just in go mode. You're in fight mode.
Exactly. And then when you're finished, they're like, bye-bye. I'll see you in 6 months for a checkup. And that's it. And that's when it hit me, is like, what the hell have I just been through?
It's a grief.
Yeah. Yeah. So a lot of PTSD, and talking to other women. One of my coworkers was going through it, almost the exact same thing. About 3 months, she was diagnosed 3 months after I was. So we've kind of gone through this journey together. But that's what I hear from a lot of people who, when they're finished their treatment, they're left floundering and just traumatized by everything that they've been through. And I just find the mental end of it is still a struggle to this day. I hate how I look now, which again, I would like to have the other breast removed. I sort of feel like that might help give me a little, I don't even know what the right word is. But I don't know, A, my surgeon won't do it. And B, will I be happier
Right.
with symmetry? Or will I just look at myself again and still be upset that I'm deformed?
Right. And it's been, how long did the treatment take in total? 2 years, you said, or 1 year?
Yeah, about 11 months. So
it's been 2 years then.
it's been 2 years.
Does it get any better, or do you find that it just, like, in terms of mental capacity to heal from the trauma?
I think I am getting there. There are times I think I need medication to kind of help me over the hump. And then I'm like, nope, come on, suck it up and you can do this. Now, my coworker, she is on medication and it's working well for her.
Mhm.
And I don't know why I have this mental block as to why I can't accept medication, but I feel like, nope, I want to do this on my own. So, the hospital just started an in-person support group for breast cancer survivors. I shouldn't say survivors, because there's unfortunately people who are just starting their treatment, and there's stage 4 people.
And so now you have in-person support group, and then what other treatment, like what has been your healing journey? Like, you realized, wow, I have like major PTSD and grief. And so did they offer any support afterwards?
Not really. I mean, they
Grab my
do.
dog, just 1 second.
That's all right.
He's just barking. Emma. Always during the call.
Oh my goodness, look at you. Hi, baby.
As soon as I put her on my lap, she's fine.
Oh.
Pays attention sometimes. Anyways,
Yep.
so how has been your, like, did they offer, this is what you're going to go through, here's
They
the
do.
plan, or like you said, did they say bye, see you in 6 months?
Yep, bye, see you in 6 months. And then when you go I guess the onus would be on me, right? To pick up the phone and say, hey, I'm struggling. And I'm sure they would offer me help then. But I do feel like they shouldn't just cut everybody free and say, see you in 6 months. Like,
Yeah.
there needs to be, they do have social workers that we have access to,
Mhm.
but it shouldn't be on us to call them.
No, because what if you're depressed and you're
Yeah.
like, such a taboo in the first place to seek mental help.
Yes.
And sometimes, yeah. So, okay, that's really interesting. I wonder if they've changed that.
Not in this area anyway.
Okay.
And again, the supports are there, but
Mhm.
I feel like they should be offering them, not
Yeah, you might go
seeking them
through,
out.
exactly, like, you're gonna maybe want to talk to someone.
Yes.
Here's the plan. Okay.
Yeah,
So now,
so-
do you have a therapist now that you got sorted with, or
So I started with one, and I didn't really fit with her very well. I just kind of thought she said, and this was right in the heat of COVID too. So it was all over the phone and you couldn't meet in person. She sounded really young, not that that has anything to do with it.
Right.
And I'm going to go out on a limb and say she's never had breast cancer, because just on the way that she was responding, I'm like, but you don't understand where I'm coming from.
Yeah.
Like, my girlfriend and I, my coworker, we can talk about it because we get it. We've been there, we've lived it.
Yeah.
I understand her feelings and her thought process, where unless you've been through it, they
Right.
don't get it.
Right.
They
Okay.
just don't get it. So I found that a struggle. One of the other things that nobody ever talked to me about was Chemo Brain.
Mm.
So I lost like a lot of my ability to think critically. I can't remember, like, my short-term memory is terrible. Still.
Okay.
And it's getting better. But again, I'm 2 years post-treatment and it's still a struggle, and nobody talked to me about it ever.
So you just think that, yeah.
Yeah. So then I go back to work and I'm frustrated because it's a fast-paced job and I have to use my brain and I have to remember people's names and, blah, 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 blah. And I couldn't do it.
Mhm.
And then I feel stupid.
Right.
And I'm frustrated because my coworkers must be frustrated with me. Now, they never ever said or did anything to make me feel
Yeah,
like
but it's in
that.
our head, right? Yeah, of
Yes.
course. Yeah.
Where if I'd been a little more prepared, would it have changed anything? I don't know. But if at least I knew going into it, hey, you're not stupid. It's because of the
Chemo.
drugs. Yeah.
And you're
Yeah.
not on any, okay, so this is just this is a lasting effect. Wow.
Yes. Yeah. So I do think it's coming back.
Yeah.
And I think it just takes a lot of using my brain. Like I didn't have to think, right?
Yeah.
And it's just, and learning, I have to write everything down now. If somebody, a client calls at work, by the time I put them on hold and go to the computer, I've forgotten what their name is. Like I write everything down. And the other vet that works for us, he now knows if he has to give me instructions, he writes it down and he gives it to me. Where before he could say, okay, I want this medication, this many pills, this is the directions. I'd be, yep, got it.
Yep.
Gone.
Gone.
So, I mean, you go into work and you're already self-conscious because you look different. And you don't have the stamina that you used to have. I do now, but when I first went back to work, right? Like you're exhausted. Mentally, you can't do the job. Like, again, there was a lot more mental things after treatment than during treatment.
How interesting that your body gets into this fight. I'm going to focus. And it just doesn't, it will fight and fight and fight. And then after it will allow you to another compartment will say, okay, it's my turn now.
Yes, absolutely.
To speak up and share with the body what I've been through.
Yes. Yeah, because I still look at my body and I can't believe like it couldn't be any more real. Like they chopped off my boob.
Yeah.
But I still sometimes cannot believe that I went through everything that I went through.
And did they give you, I remember us talking about when you left the hospital, did they tell you about where to go to find a bra? Did they give you a bra? I know they gave my mom a bra and she hated it, but they gave her something.
Right. No, they didn't give me anything. I'm just trying to think. No, I don't think they told me where to go get one. I knew of the place to go in town. There's only one place in town. And why I knew of it, I have no idea.
And it's just a breast cancer bras, mastectomy bra place.
Yes.
Okay.
Yeah, and wigs. She does wigs as well.
Okay, got it. And did you go there? I
went there to get fitted for my prosthetic, which I hate. I never wear the thing. Like I think it was like $200, almost $300.
Oh, yeah. Same brand
Yeah, there's only one.
There's only one. Yeah, my mom hates hers too. I feel bad because I'm sure they're a great company, but she just hates hers. She hated hers.
It's a nice little stress ball. That's good.
Hers is so heavy.
Exactly.
It's just like, why is this so heavy? I could use this for weights. Yeah. I'm sure they've changed since then, but
it's awful. Like it's just awful. So I think they sent me home with a list of exercises to do to get my range of motion back. Okay. And set me up with the VON to get like my incision checked and what have you. But that was pretty much it. It was just like, yeah.
Okay. So you got fitted for the prosthetic, you hated it. And then what made you come to me?
Well, to be honest, I didn't know about you. And I was literally crying to my neighbor one day. And I'm like, I am so sick of this. I just want a nice bra. Like, I wish they would make a bra where there was flat on one side. So you have like a molded cup on one side and just flat on the other, because that's what I thought I wanted. And I didn't know there was anything else, right? Yeah. And so
you didn't care about the symmetry. You didn't care. You just wanted a bra to lift up one boob.
Exactly. Yeah. At that time, I didn't care, right?
And that store didn't provide that.
No.
But it provided bras. Like, did it even provide the mastectomy? Did it provide bras?
So they had the bra, but it was all the kind that had a kind of a cup to it that you stuck the prosthetic into, like the little pocket or whatever. So if I didn't want to wear it, I still had this extra material. Yes, exactly.
Yeah.
And I don't know how my neighbor heard of you, but she's the one, I think a friend of hers or something. But she's the one that told me about you. And that's when I reached out to you. Because I had gone from wearing to just a tank top, because that's all I could physically wear after the surgery, to this god awful thing that the mastectomy store sent home with me that didn't fit properly. And it wasn't comfortable. And I remember when I got your bra in the mail, just sitting there and crying because it's so beautiful. And I felt normal again. Like, it's to this day, if I go into La Senza or one of those stores, like with my daughter, I can't go in those stores. I cry because I'm like, I will never be able to wear anything like that. You take for granted. Obviously, yes, I can come to you and I know that you will make me something beautiful. But just to go into a store like everybody else just takes for granted.
And now, do you find, I know that my mom, she at first wanted exact symmetry, and now she doesn't even care. So she doesn't, because she's like, I don't even want to wear the overly padded. You can, when you really look, you'll notice that one is smaller than the other. And she just was like, F this. So do you find that you still are craving that symmetry and you feel a bit, awkward, or do you find, like, has anything changed in 2 years about how you've been you're adjusting to your new body?
I feel like in the very, very beginning, like immediately after surgery, I was okay. Like, I didn't care if I was going into the doctors and clearly wasn't wearing a bra at that point and only had one flopping around. Didn't bother me, not a big deal. And then I went through where I wanted the symmetry when I contacted you. And again, like to put that on and to be symmetrical again. And it wasn't exact, but it was still fair. Same thing, right? If you really looked, and creepily, my brother tells me that all the time. He can tell when I'm wearing one of your bras or when I'm not.
Right.
And I'm like, what the hell are you looking at that anyway?
You have a strapless too.
Yes.
Right.
Yes.
Okay. Yeah.
I love the strapless because then I could wear a lot of my dresses that required a strapless bra before. I couldn't wear them.
Yeah. Yeah.
You can't wear them with just one boob.
Yeah. Yeah.
And so that was a game changer. That made me feel really good.
I wonder why these mastectomy bras are not like it's like, oh, the ones that you made me are beautiful. This is just fabric. Why are the mastectomy bras not pretty and beautiful? Like,
no.
They're not. And my mom said, she's like, it was the ugliest thing I have ever seen. She's like, I already feel ugly. Yeah. So now by giving me this bra and saying this is your only choice, you're just validating my feelings.
Exactly.
And I don't get it.
I don't either. Yeah. It's so industrial, and it's just, it does. It just makes you feel even worse about yourself. I am still very self-conscious about only having one. When we were in Mexico, I wanted to try on these cover-ups that the vendors were selling down on the beach. Yeah. But again, this was the day after my boob was swinging around behind me. So I didn't have anything on. And you can see a little bit of I call it a stump, but yeah. Right. So I thought, well, I'm just going to run down there and I'm going to grab one of these cover-ups and I'll try it on quickly. And if I like it, I'll get it. That'd be great. Well, no, of course, as soon as I get down there, the guy's like, oh, here, let me help you. And let me show you how you can tie it all up. So he's like right at my chest, tying this thing up, and I'm dying, like just dying, because I know that he can see. Yeah. And I'm just like, oh, here's the money. I'll take it. I don't care if it's ugly. I'm out. I'm gone. Yeah. And I can remember going back to my room and crying. And my husband's like, it's a badge of honor. Like, people will look at that and think, good for you. You survived. But I don't see it that way. I see myself looking mutilated. And right. So yeah, symmetry is still very important to me. So I went from where it wasn't. Yeah. To now, yes, it is.
And what about, you had said the stump. So I don't think many people know this, but it's not just what you see in the cartoons where there's like a nice little scar.
No.
Yeah. So describe how your breast looks right now. So, there's
I have the little stump thing, which again, there is such a thing as flat closure. So if you are transgender and you go and have your breasts removed, it is a flat incision. Why do they not do that for women with breast cancer? And I'll tell you why they don't. Is because they leave this extra skin so that you can have reconstruction.
Oh, okay.
But not everybody is a candidate for reconstruction. Not everybody wants reconstruction. So not only do I have this little nub where my cleavage would be, but along at the under my arm at the side, they call this thing a dog ear. So you have this big triangular flap of skin that was forever caught in my bra band. I have actually since gone and had that removed.
Okay.
So I had a plastic surgeon remove that. That was horrifying all on its own because she did it with a local and the local didn't take in certain places. So it was horrifying.
Oh my gosh.
But the end result I'm quite happy with. So it does make me look more even on the outside.
Yeah, it almost looks like a third boob.
Yes.
Some clients, like it's like an actual, like it's not just, oh, there's a little bit of like back fat. It's like, no, it's a boob.
No, it's a boob for sure. Like I could reach my hand right up underneath. Yeah.
And it's uncomfortable sometimes. Like it's like a third boob right here if you don't have the right bra. And most bras, the band is this narrow, so the boob just pops out.
Yes,
it looks awful.
Yeah. So I did have that removed, and I'm glad that I did that. And my surgeon told me right from the beginning that that was going to be there.
Okay.
But again, you can't tell me that you can't do that without having that.
Yeah, that is odd because all the patients, all my clients, they all have that. I've never seen a flat incision yet. So interesting. Like, if no, you're not going to have reconstruction. Is it something to do with did you have the drainage?
I did have drainage.
Want to maybe talk about that?
So they kind of horrified me all on their own. Not so much. So I had 2 drains in right immediately after surgery. And I think
what does that mean when you say have 2 drains in?
So I'm not really sure the entire medical purpose of them. I guess it's so you don't get a lot of fluid buildup between your chest wall and the skin where they've removed all of that tissue.
So it's like a pipe, it's like a syringe.
It's like a long, really long plastic tube. And on the end of it is a ball. And every day, twice a day, you start at the top where it's where it's into your body and you milk it. So you have to pull down this long straw, this long tube, so that all the fluid, and sometimes there's blood clots in there, that's attractive, go into this ball. And they stay in your body until I think it was, and you have to measure that. So then you empty your ball twice a day and see how much fluid you're getting out. And once you're less than 25 milliliters of liquid a day, then they can pull them out.
And how far is it in your?
Well, I didn't know at the time. So they have it stitched into your side. And I can remember, and you have to carry this thing around your neck with your little drain balls in them. And I can remember being terrified, like rolling over in bed or something, that I was going to rip these things out. And then when they told me, okay, I think we're going to be able to pull them out the next day, like a week later, I was again mortified. I'm like, oh my God, this is going to hurt so bad. Like, I can't even envision what this is going to be like. And they're like, take Tylenol before you come. I'm like, well, it can't be that bad if you just have to take Tylenol. So they did it, and you just like 1, 2, 3, and they pull it out. I'm not kidding. There's a good 8 to 12 inches of tube inside your body. Oh my God. I was just like, which if I'd known that, I wouldn't have been so panicked that it might pull out, because I thought there would only be like an inch or so in there.
But do you not feel like it sticks out though? So do you not feel like you're going to somehow snag it
on something? Yeah. Now at that point, you're not really doing very much anyway.
Oh yeah. Okay. All right.
So, if you were out there vacuuming or doing something like that,
true.
I'd be a little more concerned. But at that point, you're not really doing very much. And the more that you would do, the more liquid would come out. So it was in your best interest to rest so that you could get them pulled sooner, because the longer they're in there, the more risk you have for an infection.
Well, besides what you've told me, is there anything else that you would tell women, like advice or something that you maybe didn't get a chance to say?
My big thing is just know that they're not going to be sick the entire time if they have to have chemo. But even before that, cancer is not a death sentence anymore.
Yeah.
And that was an eye opener to me. Right. As I said, as soon as I heard the word that I had cancer, I was digging my own grave. I was sure that it was fatal, and I just went off the deep end. So take a breath. Treatments have come a very long way.
Yeah.
And they also have a lot of supportive medication so that you're not sick like you see on TV and movies and stuff like that. And there are good days in there. And don't do it alone. Like, you need people to talk to.
Yeah. 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 I have learned so much in this conversation.
I hope
I'm
I didn't
all-
gather too much.
No, I actually think that this would be, I hope that I'm able to share your story and help other people, maybe get some insight as to some things that they didn't know. I'm almost thinking this whole conversation is worth like putting up on YouTube or something like that, where,
Absolutely.
yeah, because there's so many things that like, the drainage, like I've heard about it, but I haven't, the clients, when clients come to me, it's past, it's post the tube,
Yes.
removal and things like that. So, are there any products that you'd recommend that are, that you kind of discovered that maybe it would help, just so that, the purpose of this video?
Boy.
Anything that you'd recommend they buy or they see, or like, if you even if you think about it after, just let me know. Because I'm,
Sure.
I know some products, breast oils, and there's a tattoo artist that tattoos like an invisible nipple, which is super cool.
That is very cool. I've seen that done.
Mhm.
Uh, I know that for me, reconstruction wasn't an option because I had radiation.
Okay.
So there's a couple different ways you can do implants. Implants weren't an option for me because of the radiation. It damages your tissue and it just wouldn't hold very well. But vitamin E cream I used on my incision. That's what my surgeon recommended. I rubbed it on there a couple times a day, which creeped me the heck out, having to touch there and rub it around. And just boo. And
Yeah.
you do get phantom boob pain, just so you know.
Okay. Okay.
Yeah, sometimes you feel like you still have one, which is interesting. But
Thank you so much for like agreeing to meet with me and share the journey. It must have been a little bit tough to relive some of the times. So I really do appreciate that. Like, I can appreciate that that this was a little bit challenging for you, and I didn't realize how it would be. And so I thank you so much for doing that. I really appreciate it.
oh, you're most welcome.